I see the live button, Jan.
Yes,
We
I
are
see.
live on X, LinkedIn. It sounds like we're on Instagram and YouTube today. So, first and foremost, I'm here with Dr. Yann Meunier, and I'm extremely excited to have a conversation with you. So, welcome, welcome. And I'm gonna throw the microphone to you in a second, but first we have to put up our medical disclaimer here that anything we talk about within the program today, both from Dr. Meunier's side as well as our side here at the Ovadia Heart Health team, is not personal medical advice. This is intended solely as instructional, educational, and informational. If you do have personal medical questions, please address those to the team at ifixhearts.com. Okay, that was our formal thing. And again, welcome. So delighted you've been able to come on live with us today. So, for our listeners, Jan, how about you just tell us a little bit about what you've been doing, what you are doing, and anything else you'd like to share with our audience today?
Yes. Okay. What I've been doing is a bit too long to explain, so I think maybe you could go on on LinkedIn and find out my profile there, and there's a lot of explanation there. But I prepared a few preliminary remarks to put things in context and provide some answers to maybe a few questions already. And I would like to make 4 points in 4 minutes. So, firstly, regarding my vision for medicine of the future. I think that medicine of the future should be preventive medicine heavy, should be based on the elimination and mitigation of disease risk factors, and it should be holistic. That means it for all diseases and from cradle to grave. How should it be organized in the American context? I think the patient will be working with the primary care physicians and they will draw their own health roadmap. So there are four main components and roles in that scheme. The primary care physicians assess the risk qualitatively, and they detect the risk in the family history, past medical history, comorbidities, immunization, age, gender, ethnicity, nutrition, living condition, lifestyle, job, social well-being, leisure, exercise, screening, and assessment. In particularly, the test the genetic markers, biochemical markers, and also serological markers. Second actor are the corporation, and the corporation contribute with HRAs, health promotion programs, and employee wellness programs. The third one is insurance companies, and insurance companies should be calculate the risk. They should gather all the data and evaluate the risk quantitatively for all diseases and for each patient. And now that AI is available, I think they will be able to do that. And the last one would be a government agency because they need to provide supervision of these insurance companies. I know this can be debatable, but to me, just as the Thomas Mann, who was the Nobel Prize literature recipient, he said that everything is politics. So there we go. Secondly, though, my second remark is regarding corporate wellness. So corporate health promotion programs and wellness programs are cogs in the wheel of preventive medicine, which is part of the healthcare system. So there are pieces that when one is altered, it affects all the others. It's just like to have a visual impression is the Calder mobiles. When you touch one, the whole structure moves.
Right.
So what are the tools at our disposal? I mean, corporate wise. There are only six that can six lifestyle behavioral, fully personal levers that one can use on disease prevention. Exercise, diet, including food and drinks, stress, sleep, smoking, and medication over-the-counter preventive medicine, like some vitamin, for example. What are the limitations to these programs? So there are old limitations that have been there for forever. limited employee engagement. And then we can delve into this later, maybe to know why, what the reason there is a limited employee engagement. Then another limiting factor is across the board approach. Some people don't like across the board, they want something more specific that applies to them. The other one is wellness without well-being, considering wellness without the context in which the person is living. Next one would be inadequate metrics, and that's a very important one, and maybe we can also delve on this a little bit more further on. And the last one would be privacy concern about, having that data disclosed to people they don't want to. And now, what are the new challenges? I can see two new big challenges for corporate wellness. The number one is competition with the primary care physician. As you know, there are some structures, some companies, like they offer wellness programs through the primary care physician. One of them is MD VIP, and they provide screening and tests and custom wellness plans. So that's the first challenge. And the second one is healthcare plans. You know that, for example, United Healthcare, they offer preventive care, they offer fitness program, they offer mental health program. So those are the big challenges, the new ones, in the recent years. My third point would be regarding the future of corporate wellness. So two sides. The long term, I see more collaboration between corporation, insurance companies, and primary care physicians. And for the short term, I think that there should be, and there will be, probably, hopefully, more individual focus, because that will provide more engagement, more motivation, and more granular individual profiles. And the second one is a more complete health risk assessment, just like I mentioned. And this will give more thorough health pictures of each participant and better assessment of impact, which is a big thing. Because one of the doubts is, okay, what is the result? And will it last? And these kind of questions. So I'll give it now a few tips for 2025. More face-to-face interaction, more mindfulness, more team bonding, less sedentary time, and using new corporate wellness benefits. So, and my last point, fourth point, is regarding global and public health and disease risk factors in developing countries. In developing country, poverty is the number one disease risk factor for all diseases. It's the number one. So alleviating it should be priority and target number one for global health. But it is far from being the case, and it's never been the case. So now I'm ready to answer your question, Krisna.
I love it. That was absolutely fabulous, Yann. So much information to unpack there, and just shows the breadth of your work over these decades. I'm not quite sure where to start. And again, I will encourage anyone to look up your bio on LinkedIn if they want to know about your past work. So let's start with assessment, right? Yes. Because that is, if you look at any of the old corporate standards for how do you do a wellness program, it starts with assessment, right?
Yes.
So what I loved about many things that you said in there was you talked about a holistic assessment as well. Yeah. And I think a primary word was qualitative. Yes. So how would a holistic qualitative assessment for a company employee wellness program look to you?
Okay, so let me talk about the metrics that used to assess the program. Participation rate is not a good metric. It's not a good metric because you don't know what they're doing. I mean, just sign up, and after a few sessions, they just give up for many reasons. Non-specific health outcomes. For people would say, okay, well, I feel better, or I improved my personal life, or this kind of stuff. Then there's the other one, the pitfall is short-term results. This is not good enough. I mean, you want the long-term impact of your programs. Another one would be self-reported data. Self-reported data are not trustworthy because they're subjective. And another one is absence of common standard between the different programs, between different programs, also the same program in different companies, they measure them differently. And the last one would be absence of context. You cannot measure only the impact, for example, on smoking cessation. You have all other benefits that are derived from that should be also measured. The social, also the work environment, the co-workers, even in the family and friends and so on. So this is what I think in inadequate metrics. That's what I see the problems. Now, your question is different. Your question is the quality of the program. And the quality of the program, to me, is measured by the quality of the results. So how do you assess the results? So in order, you have to design an assessment that will encompass all the different benefit that would be derived from the program, because it's not only one specific program lose weight. Okay, the person lost weight, but what does that do in terms of for example, disease, the risk factors? I mean, obesity is a risk factor for cancer, it's a risk factor for osteoarthritis, for heart disease, and others. So the assessment should be broad, should be wide, and also in that spectrum, it should be specific. You should have something that you can measure with numbers. So that's how I see how we get the quality of the program. You can assess it and have a global vision, but with specific metrics.
Exactly. And it's a cliche saying, right? You can't, what is it? You can't measure what you don't test, right? And if you don't have specific measures, you're not really knowing what it is you're looking for, and if you've actually really moved the needle or not.
Yes. So it all comes under the umbrella of how you frame it, the way you frame your program, and what is the vision. You need to have a vision that is broad enough to measure the real impact. So it starts with vision and framing.
Yes. And something that we've been talking about recently too, and I know that you've talked about this, we'll get into the behavior change piece, but there's even a recent paper that came out about how managers and leaders implement the program but don't participate in it. So they're not really showing by their own actions that they're part of the program. Okay. Do you have any words or insight on leadership participation and sort of leading by example?
Yeah, the leader is a role model. He has to be a role model. Otherwise, it's this thing, do as I say, not as I do, and you lose credibility, and then you lose your impact and also the engagement from the different participants. I mean, why should I trust you? You're not doing it. So you know what I mean?
Yeah, absolutely. I'm going to sort of jump around. I made lots of notes all around my paper, but this idea of the corporate employee program or employee wellness program being the cog in the wheel, meaning it could also impede your health as well, right? That be a positive influence or it can be a negative disruptor.
Yes, this is why I think, and this is not existing right now, but I think there should be collaboration between the primary care physician and I don't know if all corporations have a medical or have a physician on their staff, but there should be a physician in each company that would liaise with the primary care physician and also with the insurance companies.
Yeah, So this is, and not to just be highlighting our own program, but with the Ovadia Heart Health team, we have a heart surgeon overseeing our employee wellness program. So we have this direct medical oversight like you had at Stanford. And it just, you have that piece and connection who also speaks the language of the other medical doctors, right? And oftentimes employee wellness programs have been a kind of either or. They haven't really fully embraced this integrative model.
Yeah, because if you engage, for example, with the insurance companies, if you engage in a program, you lose weight, you stop smoking, your premium should go down. Just like with auto insurance, you don't have any accident or anything, your premium goes down.
Yeah, and one of the focuses that we've been utilizing too is the markers of metabolic health.
Yes.
We know the waist circumference, blood pressure, blood glucose, triglycerides, and HDL. And I know a lot of problems arose back in the day in wellness programs that everything was self-reported.
Yes.
Right.
Yes.
And we know there's a lot of challenges with those metrics.
Yeah.
And if you can have those officially recorded, can be a boon to your program.
Yeah, and HbA1c also. Maybe you have that too.
Yes, HbA1c as well as fasting. We recommend fasting insulin as well as part of the sort of metabolic scorecard for individuals. I want to also talk about this. You talked about the exercise, diet, stress, sleep, also medications. Working with that it's really this combined package. It's not just one piece because, let's say, historically, I've worked with a lot of companies, and the focus was always on weight loss or some kind of, biggest loser challenge.
Yes.
But not thinking about the mental health piece, the stress management piece.
Yes, absolutely. And then it impacts the rest also. Stress management, then you have better sleep, then you're more productive, then your mood can be more optimistic. And you have better relationship with your coworkers and so on. So this is each of these have impacts on the others.
As
a matter of fact, some have negative impact because, for example, if you stop smoking, sometimes you can put on weight.
That's right. We're running for one of our groups, what we're calling a how to quit group. And you see, oftentimes you quit something, it transfers to something else. Whether you quit smoking, then it becomes a food thing, or you quit drinking and begin smoking. So they're transferable.
But this is how we go here into the behavior.
There you go.
Behavior change. And behavior change, it's the same for each of those things. There are techniques, there are programs that at Stanford there was one with Debbie Balfans. I mean, she was the one in charge of modification, but there are others but it's all it's all generic, and if one applies to it can be across to apply to the other, and of course personality type. If you have smoking is an addiction, so you become addicted, and some people are more prone to addictions. So that what happens is what you said. It's like they switch to something else. Yeah. As a matter of fact, I've seen the smokers that become addicted to exercise.
This is true, right? And this is something we don't talk about, that oftentimes also then they become these chronic exercisers, right? They begin over exercising to put that energy someplace. So one interesting thing from one of the groups we've been running is it's been helpful for these people with various addictions to help each other. So they made a support group. So it's not feeling isolated that it's just the smokers or it's just those people who have, whether it's a food addiction or an alcohol addiction, that they can support each other.
Yes. Well, that's part of the therapy. Yeah. The AAA, the Alcoholic Anonymous.
Yes.
That's part of the therapy, the group support.
The group support. And that's what a good employee wellness program is that support tool. Like you say, it can be a positive addition to the wheel. I wanted to talk a little bit. Oh man, so many things to talk about with you. You definitely have to come back, Yann. What do you think has changed? I know you had what you saw for 2025, and I love those ideas, but what would you think has changed the most? Let's even just say over these last 10 years when it comes to employee wellness.
Well, they have become more and more scientific. That's the number one. Number two, they become more widespread. I mean, before it was only the elite or the Silicon Valley corporation that used to do that. Now everybody's doing. I mean, almost everybody's doing it. And the people who are in charge are more and more competent, and there's competition there too. Before it was at the beginning, like for anything else, whenever whoever was interested in it. now you are you have to show the experience, your results. This is maybe the most important things. Everything is result driven, and now well, because also sometimes of money constraints, the corporations don't want to waste money. I mean, that's a rule. So they want to know what they get for it. And
yeah,
and it's obvious they get a lot from it. To me,
this is true in a result. Let's see, if you're the CEO of a company, this is a question we hear all the time. How long do you think it will take us to see results?
Yeah. Yeah, okay, but this is the question you cannot really answer, because and as I said in my remarks, it has to be more and more individual. It has to be more and more employee specific, because that's what they want to know. How does that apply to me? You know what I mean? If you lose 20 pounds and you're 40 pounds overweight, it doesn't have the same meaning as if you are 100 pounds overweight. So the employee might not be as satisfied. I mean, I lost 20 pounds, but I'm 100 pounds overweight. Well, it doesn't work very well. But the other one, he lost 20 pounds out of 40. He should feel the improvement right away, in terms of being short of breath, being able to exercise, and feeling better altogether.
Yeah. So this brings up an interesting point. When your emphasis was on holistic and qualitative measures as well, we talk about those metrics, those hardcore ones we want to measure, right? The metabolic health markers, and maybe oral, more like you talked about HbA1c, but also measure some of these, and how to do that would be more complicated, mood, energy, performance, to have some sort of other metrics that we could at least be tallying and calculating.
Yes, but I think in the sphere of psychology, there are some measurements. There are some scales that you can use, for optimism, for energy, they use this for in case of depression. They measure the level of the depression, and they assess quantitatively where you stand, where the person stands. That's quite important, because of the risk of suicide.
Absolutely, and I know that you work on the global health scale, that this is something that has increased since COVID, right?
Yes, absolutely. The fact that people were confined, that gave birth to quite a number of psychological issues.
Yeah,
in children particularly, that is not measured. The impact of the pandemic. Very rarely they talk about the psychological issues, especially on children.
Yes, and I think for many areas this has been devastating. Yeah. And I think as you started talking about, your 4 points all include, at some way along that journey, the employee wellness program. And maybe as we sort of think about kind of wrapping up our talk, if you had a magic wand, would there be one or two of your points you feel that would be the starting place for someone who isn't currently doing an employee wellness program?
Well, to me, the starting point is to assess the readiness. Is the company ready, and are the employees ready to engage in this kind of activity and initiative? That's the starting point. And then after that, you have to assess which one. What is the biggest bang for the buck?
Mm-hmm.
What kind if you have a population profile in terms of health, and it's okay. Well, let's say an example, an easy one with smoking. If we have 15% of the employees are smoking, I think this can be a priority.
Yes. Yeah.
No, but this is an easy example. But stress, for example, how many people have stress in this corporation? And now also I must add that wellness is not always the state of wellness, but resolved by a program like this one. Sometimes it has to deal with the management, how the leadership is dealing with employees. What are the values? Are the values only on the wall, or do they apply it in daily life?
Oh,
and
yeah.
that is responsible. So you have to act at the source of the problem. See, if you just try to diminish the level of stress, it's just palliative kind of approach.
Yeah.
The real reason is, for example, the manager that doesn't have any skills of how to manage his employee, and sometimes they don't consider the person.
Absolutely. And sometimes it all comes down to communication.
Yes.
But everything, it seems, again, as we get close here, comes back to that behavior change assessment, the readiness to change. We will often say, people are only going to change when they're ready to.
Yes.
But within the corporation, we have to give them the tools to be able to make that decision.
Yeah. Okay. And the second one would be awareness, because many people don't know about the wellness program, and this is where you need to show results. You need to tell them, okay, our programs, we have achieved this and this and this and that. Would you be interested? Otherwise, it's too vague.
That's right. I mean, sometimes it's just that simple, right? Ask the question, but and make sure they have ample opportunities to respond, because, as you say, a lot of programs are on the wall, but we might not actually be doing them, in the practical.
Another thing also I want to say is it has to be interactive. It really, and the employee should be the driver, because that's for him. So what you do, you give him the information and then say, okay, what do you want?
Well, Yann, this has been an absolute delight. We just barely scratched the surface here. I appreciate all the work you've done, not only as a global health medical doctor, but also in the space of employee wellness. Your efforts are really high up on the list. So if people want to get in touch with you, they can look to LinkedIn, right? You're pretty active on LinkedIn. His name is right here.
Yeah, it was spelled wrong, so I think.
Yeah, we corrected it, I believe. Yeah. Please come back again. And
my pleasure, Krisna.
Thank you for sharing your global wisdom. And if anyone didn't get a question answered, please reach out to us at the Ovadia Heart Health team. And thank you so much, Sean.
You're welcome, Krisna. My pleasure.
Okay. Bye-bye.
Bye.